For Raymond, and I'm with BrainLinks. I'm going to go through a presentation with you all today about concussion and brain injury from mental health and substance use disorder settings. I will ask that if you have any questions as we go, you're welcome to ask them, or we can do them at the end, however you guys like. I do see a little bit of the chat box in the view that I have, so if you have some questions about what we're talking about specifically as we're going, I'll try and stop and address those. But I'm also going to try and keep us on time. So I know that we'll have a session of at least an hour. We might go a little over. We've got the time reserved for up to 90 minutes, but I know that the PowerPoint is going to take at least an hour. So we'll go ahead and get started. Please think about as we're going anything that you might want to ask, and know that we're going to go over some resources at the end that will be helpful to you, that you can use and that you can share with others. Let me switch my slide. Just to give you a little background on BrainLinks and what we do. We are supported through a federal grant from the Administration for Community Living, and in part with the Tennessee Traumatic Brain Injury Program. And we're a program of Tennessee Disability Coalition. And just to give you a little bit more information about our program and what we do, I'm guessing that several of you on our call are very familiar with our program and our work. But for those of you who may not know a lot about us, we're a statewide team of brain injury specialists. I'm in East Tennessee, Wendy and Paula are in Middle Tennessee, and then we have Carrie in West Tennessee. And we equip professionals to better serve people with TBI with current research-based training and tools. So we offer our training. We have a great website with lots of family-friendly educational materials. We have trainings and materials that are for all ages, for children returning to school, preschool, and even older adults. So the whole age range. We have toolkits that are for healthcare providers and school nurses right now, but we are about to have available to everyone our brand new toolkits for families and for other types of service professionals. So those are going to be exciting. We're about to release those on our website soon. And we have a YouTube training channel, and we'll talk a little bit more about those as we go. Just how we're going to spend our time today is going to be an overview of traumatic brain injury and concussion. Always start with that. And then we're going to have, we're going to talk more specifically about how there's an intersection with TBI and mental health and substance use disorder. And then we'll talk a little bit about ACEs, adverse childhood experiences. And of course, we're going to go over some great tools that we offer to help. And that's only going to just be a glimpse of the things that we offer. We have so much more on our website and on our YouTube training channel. And just to think a little bit about traumatic brain injury and how common it is. Traumatic brain injury is a leading cause of death and disability among children and young adults in the United States. And it's an estimated 1.5 million Americans who sustain a TBI every year. And if you think about how many that is, sometimes when you think about a huge number, like 1.5 million every year, it just doesn't really sink in. For me, it doesn't. And if you think about how common that is, how often it's actually happening, that's one person every 9 seconds. A traumatic brain injury, the definition, is caused by a bump, blow, or jolt to the head or body, or a penetrating injury that disrupts the normal function of the brain. So if you pay attention to that, to the head or body, that kind of gives you this indication, but we might have all grown up thinking that you have to have a direct hit, actual contact with the head to have a brain injury. And you don't have to have that happen. You can have the jolt to the body, or you can be in a crash or an explosion or in some situation that jerks your body or jars you in a way that your head is actually what causes the injury to the brain, your skull. So think of something like whiplash. Your head may not come into contact with anything with an accident like whiplash, but you can still have the injury, not just to your neck, but also to your brain. And only 1 out of 10 people actually lose consciousness. Other ways that you can have a brain injury that are acquired, so happening after the birth process, are brain tumor, stroke, infection, surgery, or drug overdose. In Tennessee, the 3 leading causes are falls, motor vehicle crashes, and violent injuries. But there are lots of other ways that someone can have a TBI. Just some examples: being struck. In Tennessee, we have a lot of occurrences with ATVs. That example we just had, whiplash from collision, and also things like being pushed or shaken. Whether someone's shaken as a baby with what people call shaken baby syndrome with abusive head trauma, or even shaken really hard as an adult or as an older child, that can still cause the type of injury where the brain is moving inside the skull. And when we talk about any kind of injury to the brain, the type and the severity of the injury can make a big difference on how someone experiences that injury and what types of symptoms they might have. It's a very individual type of injury with a very individual set of symptoms that happen for everyone after brain injury. Your brain controls everything that you think, everything that you do, everything you say, learn, remember. Your brain's really in charge of all of your life, everything that goes on, and everything that's happening in your body at the same time. So if you experience a brain injury of any type, it's likely that you're going to need some type of supports, at least for the short term. When we talk about how those injuries occur, and I know that we just went over 3 of the most common ways that we usually are thinking about: car accidents, maybe sports injuries, or a more obvious type of violence. Also think about things that might seem a little bit, painful, not okay, but maybe not so clearly the cause of an injury that's going to cause lasting effects, like smacking somebody in the back of the head, someone being hurt regularly, maybe in their home, maybe at school, maybe being bullied. But an injury like that with repeated blows to the head can also cause concussion and cause changes. Any brain injury is a serious injury. So in Tennessee, there are approximately 68 people who experience a traumatic brain injury every day, and that's 25,000 Tennesseans every year. When someone sustains a TBI, their family and the people that are working with them really need to be aware of the injury so that they can keep it in mind for any problems that arise and apply any education that they have to be able to support them better. What we're looking at here is a picture of the brain. This is on the CDC's website. So if you're really interested in seeing this, it's CDC, What is a Concussion? But just for the sake of kind of thinking about that injury, for example, the whiplash type of injury, or even these others like being shaken or having a hard jolt. When you look at this picture here and you think about those lit up areas behind the eyes and that spot there at the back of the brain, concussion is more of a functional injury compared to other types of injury where you might see changes in the structure of the brain. So that means it shows up more in the way that you can do things or can't do things like you could before. So usually the injury will not show up on a CT scan. And often there's not going to be a CT scan done when there's a suspected concussion. So having a clear CT scan, while it's good news, it's not going to be an indicator that there's no concussion. So when we look at this image, think about the brain and think about this person driving a car and maybe being hit from behind. So if they're hit from behind and their head jerks forward, they have this first injury, the lit up spot in the brain right behind the eyes. And then with the movement of stopping, they're jerked back and their head and their neck is jerked back. So that impact on the back of the brain is the second injury. And it's actually the skull that's causing the injury. Now, in a best case scenario, there's only one impact and then the opposite impact again. That's two. But very likely if somebody's in a car accident, they're going to be moving in different directions. They're going to at least have that bounce back effect once, but maybe a couple of times, or maybe the car might be moving in a direction that the brain hits inside the skull on the sides of their brain. So this is just one example of how that works. Think of it kind of like a ricochet effect. The chemical cascade is when the chemicals inside the brain at a cellular level rush out of the places where they're supposed to be into places where they do not belong. And that causes the actual injury, like the tearing, the swelling, and the different types of symptoms. So when we think about concussion, there's not going to be much to see on the outside. It's really the things going on that are inside that we don't know about, and the changes that they cause in the functions that a person has. Some of the symptoms that you can't see, like headaches and fatigue, can be present and are most common, but they can be just as serious as those that you can see. It's much easier to notice things like changes in balance when somebody's walking, motor coordination, much easier to pick up on someone who's having word finding problems, can't sleep. Those changes can begin immediately following the injury and improve later, while some might last a longer time, depending on the injury, the treatment. Really another way to explain how every injury is completely different. Some of the less noticeable changes might be things like changes in vision, feeling confused, depression, but are also very common problems after a TBI. When there are changes in the behavior, you might want to look for why that's happening. It's much more important to understand the why behind it so that you can see how to help someone. And often that why are these types of symptoms. So changes in executive functioning, changes like impulsivity, trouble initiating a task or a series of tasks, not lack of motivation, but a change in the brain stopping you from being able to take the steps needed for organizing a set of tasks. Judgment, self-monitoring, being able to think about how you look, how you're interacting, and how that seems to someone else. Any injury during this developmental time when a child's brain is developing, if we're thinking about an injury that may have happened in the past for someone that you're working with who might be an adult now, or if you work with children, anything from 0 to 25 is a time of brain development. And especially the changes that can go on when there's an injury to the brain during this brain development time can really show up in these executive functioning abilities that happen dependent on that brain development and dependent on healthy development in the older years. I want to just touch on some of these changes for the younger child, but I also want you to think about these for adults as well. So for a younger child, they might have changes that are more obvious in their behavior being different, behavior dysregulation, decreased engagement, so kind of withdrawing from people, and then maybe having behavioral challenges or problems. There's a study that followed this and found that these were the two main changes that were observed in younger children, but this also might be something in adults who aren't able to communicate as well, because if we're talking about younger children who have these experiences but can't express what's going on, it also could apply to some adults that we're working with who maybe have these experiences but can't maybe get the words together to be able to say this to you, or who communicate nonverbally altogether. Pain indicators could be things like being anxious or agitated, something physical that you could observe, like an increased muscle tightness or a change in facial expression, not just in children, but also in someone like I was describing that as an adult can't communicate to you exactly what's going on. So you always want to be able to think about that and look for those pain indicators in case there's something more going on. Danger signs after concussion, especially for a more severe injury, would be drowsiness or inability to wake up, slurred speech, seizures. You see the list here. And like I said earlier, only 1 in 10 actually lose consciousness. So if you see anything on this list, it's much more than a concussion, and it is an indicator to get someone to emergency help immediately. Now, for most, like we mentioned a minute ago on the types of symptoms, fatigue and headache are the most common symptoms for most people in the first week or so following concussion. If they continue to go on to have symptoms, what the University of Pittsburgh Medical Center has found is that people tend to fall into one of these 6 clinical trajectories or 6 types of concussion. So that might be changes in balance, vision, cognitive changes or fatigue, post-traumatic headache, which happens more commonly in people who had a headache, had problems with headaches prior to the concussion, cervical or neck related issues, and then mood and anxiety. And it's not just that they might have one of these categories of symptoms, it's that they might have one or more of these categories combined. But these are the areas that most people tend to fall into. And what's great about the treatment method that they have is that while recognizing these symptoms and that most people will heal quickly, maybe in the first 4 weeks or so after concussion, not everyone does. And not everyone can go without treatment even during those 4 weeks. They really need help sooner. So what their method of treatment is an active treatment of the symptoms present. So that doesn't mean that on day 1 they're going to go into therapy for each of these areas, but maybe even week 1, after 2 or 3 days of moderate rest, they are going to start doing some therapy to work in these areas. And if you notice, as we look around at each of these examples, they include exercise. So that might be a very limited, very gradual and supervised type of exercise. But for each of these areas, there is a level of exercise involved that can be helpful to them. So we're no longer waiting with just rest and time to see if the symptoms go away. We're actively treating each of these symptoms for the individual to help them get better quicker. The research has shown that it helps. Our concussion protocol is right in line with this way of thinking. The concussion protocol is included in our toolkits for healthcare providers and for school nurses, and it's very simple. You're looking at the protocol over here on the right. It's just a single page, and it's a tool that we want to get into the hands of healthcare professionals across our state. We're wanting to be able to educate both future patients and medical professionals to always think of concussion as a 2-visit diagnosis. So the first visit is when you get checked out, you get the information that you need to go home. The second visit is scheduled while you're still there at your first one for 4 weeks later in case you have lasting symptoms, in case you're one of those people that falls into those different types of symptoms for TBI that we were just talking about, and that you're going to need more help so that you're already getting that follow-up. And then if someone doesn't have symptoms, you cancel the appointment. You don't have to keep it if you're better. And then really focusing on bringing up that concussion, bringing up that injury every year at those follow-up appointments, just in case, just to make sure that no more people are getting misinformation or falling through the cracks or not feeling comfortable and going back to their doctor after concussion, and that they really leave knowing what they need to know. Anoxic brain injury. So we're going to talk a little bit about specifically the types of brain injury that have to do with oxygen in the brain. In 2015, the Media Research Center reported that drug overdoses had surpassed motor vehicle accident fatalities nationwide for the first time. This was news to me when I first read this. I know I've heard a lot in the news and in brain injury about the opioid epidemic. You can't not hear that and make some kind of connection, but I don't think that I'd ever really heard it said this way. Toxic brain injury. So the opioid epidemic has led to the creation of a new term, toxic brain injury. And that occurs from prolonged substance misuse and non-fatal overdose. So this is all based in the amount of time that your brain either doesn't have the right amount of oxygen or is completely cut off from oxygen. And just to be clear on the two different definitions, anoxia is a complete lack of oxygen to the brain, so zero oxygen getting to the brain. And then it's hypoxia when there's not enough oxygen getting to the brain. And that cellular change, when we were talking about the chemical cascade with concussion, that cellular change that's happening, it can begin within just minutes of not having adequate oxygen to the brain. So not having oxygen to the brain for any amount of time is potentially very serious and potentially fatal. If the blood's not delivering enough oxygen to the brain, there's a very serious chance of injury or death. And in the United States, cardiac arrest is the most common cause of hypoxic injury. Other causes are near drowning, smoke inhalation, carbon monoxide poisoning, shock, septic shock, drug overdose, and acute lung injury. So the bottom line is that the brain needs oxygen to maintain life. As we've talked about some of the ways that somebody can sustain a traumatic brain injury and the symptoms they experience, how do those affect their mental health? And the answer is not simple. There are so many parts that overlap when it comes to mental health and substance abuse and traumatic brain injury. And we're just gonna talk about those a little bit more. What we're looking at here is the Brain Injury Association of Virginia fact sheet for mental health and brain injury. We really like this resource. It's included in our toolkits and it's on our website. But it's a pretty complex relationship between mental illness and brain injury. Brain injury can lead to new mental health issues developing, and mental health issues can make brain injury worse. So it's really something that where you already have the brain injury, then you have a mental health or illness develop, or symptoms from the injury that look like a mental health, a mental illness develop after the injury. It's kind of hard to tell. While a lot of the symptoms of both overlap, not all mental health issues develop after a brain injury as a serious enough issue to be called a disorder. And that doesn't mean that they're not real, that they're not important, or that they don't cause serious challenges. You still need to seek a mental health professional who really understands the injury and keep up with the symptoms and the timing of how things happened. Did the change occur? Did the new symptoms develop after the brain injury? Very important to note. And then knowing this can help address the symptoms that you're experiencing and make things a little bit better. We include these resources from Brain Injury Association of Virginia and this one from Ontario in our toolkits. This is Concussions and Mental Health. And essentially it goes through knowing what symptoms to look for, talking with your doctor about your mental health, really stresses an individualized treatment plan. And part of the reason for that is just the very individual nature of TBI, and then having a strong support system. If you think about this, the suggestions are really similar for someone with a physical illness. What to look for, talking with your doctor about it, having your own treatment plan, having a support system. The stigma for mental health challenges, the stigma for concussions is really changing. The focus is still the same for both of these types of challenges as for somebody with a physical illness like cancer. So why is it so important to understand TBI? The history of TBI is often hidden with people with substance abuse, mental health challenges, and there's such a crossover between brain injury and each of these different areas. A history of incarceration, domestic violence, and then there's always that part to think about. Did they have the injury before they were homeless, or were they homeless and then they had the TBI, and then that just complicated matters more, and then that leads to changes of behavior. It almost seems like it's impossible to figure out what the root of the problem is and how to fix it, but it is helpful to understand just a basic understanding of the brain and traumatic brain injury if you're working with people that that are in each of these areas, because it's very likely that they might have a TBI. While there's really no good age to have a brain injury, we know that there are really important times of brain development in the frontal lobe, especially during the late teen and young adult years up to 25. And that period of development can be changed. It can be altered with injury. It can cause new learning to be delayed, disordered, or to not happen at all. So it's a time to really pay close attention if you know someone who had a TBI during this age range. And think too of people that you might be serving now who could have been injured at this time in their past and may have been at risk for some of these other things. Youth ages 15 to 19 have higher levels of abuse of alcohol or drugs, depression, attempted suicide. The American Academy of Pediatrics now suggests screening for drug and alcohol use at age 9. There's really a great need for continuing to watch, like we were saying about when you have that annual trip back to the doctor after concussion. Anytime someone's been diagnosed with a concussion or any type of traumatic brain injury, there's a need to keep checking on them because they are more likely to go on to become obese, incarcerated, abuse substances, become depressed. It's just putting them in a higher risk category for these issues down the road. And when you think about the injury that we talked about a little bit earlier, when we looked at the picture of the skull and the brain, and we talked about the brain moving back and forth inside the skull, this really helps you focus in a little bit more on the frontal lobe and the importance of that section of the brain. This is kind of your braking mechanism, the part of your brain that can stop you from acting before you think it through, to stop you from doing something that you will regret later. This is more of the adult part of your brain that you really need to have the chance to develop as an adult. So this section is in charge of judgment, inhibition of behavior, just a very important part of what you need to develop to become the adult that you're going to be. So possible psychosocial changes with TBI. These are just going to be some of the things that you might look for in someone with the history of TBI. A low frustration tolerance for an overly stimulating environment. Think a lot of people talking at once, a lot of activity going on around them, but also low frustration tolerance with themselves. their own ability to do things has been changed. And then they might be frustrated at knowing what they could do before, but now they're having trouble with something that should be much easier. So that's just one of the things that might change. An impaired self-control. So being impulsive, being verbally or physically aggressive. Think of somebody with road rage, for example. They take something that's a really small problem, and instead of moving past it and just letting it go, they overreact and they act without thinking. If that's maybe not a good example for you, if that's too much to think about or something you can't relate to, think of your teenage self. Think of decisions that you might have made as a 15-year-old or 18-year-old that you would never, ever do the same way again today as an adult. It's that self-control, it's that judgment, it's that frontal lobe of your brain that developed as it did that helps you to see things differently and do things differently now. There can also be a worsening of the pre-existing challenges that someone had before the injury. So someone who was already a little aggressive, a little high strung, someone who already needed a lot of supports in different areas might continue to need those, but also need much, much more. Essentially, it's just really important that when someone's having these behavior changes following a TBI, that they have a really positive environment of people who are educated about the injury and can provide a really positive support to work with them, apply positive strategies, come from a place of understanding the injury, and see the change for what it is, a change in the brain that happens as a result of an injury, not a choice. A little bit more on some examples of what you might see. Rigidity and flexibility. So a way that you might see that is someone who's not comfortable with a change in schedule, not comfortable with a change in plans or how they expected things to be. Impulsive behavior, like saying things the minute the thought comes to their mind, or walking into a library where everyone's supposed to be quiet and talking really loudly, just not being aware of what's going on around them. Brain injury and substance abuse or substance use. We've always referred to brain injury as the silent epidemic. And now opioid overdose is the second silent epidemic. For every overdose death, there are approximately 50 overdose survivors, 90% of whom become impaired because of insufficient oxygen to the brain. So that's what we were talking about earlier with the importance of oxygen in the brain. It's not just, it's for if you're going to survive the overdose, then having the brain injury to live with afterwards is the problem. And that's a whole new set of people with brain injury of a different kind. After TBI, many people are discharged with opioid prescriptions for pain, 70 to 80%. And they're 20% more likely to develop a problem months later, but with education about this risk, they're more prepared. 50% of brain injuries occur when someone's under the influence of drugs or alcohol. So 14%, I'm going to just throw some statistics out here for you for a minute, because as I was looking into research for this presentation, I was learning more about substance abuse myself in relation to TBI. 14% of high school students reported having ever used illicit or injection drugs. 14% of students reported that they had non-prescription use of opioids. And then drug use is also associated with risky behavior that can also lead to more opportunities for brain injury. There's a strong correlation between substance misuse and brain injury. approximately a quarter of those entering brain injury rehab are there as a result of drugs or alcohol, and then 50% receiving treatment for substance misuse have at least one brain injury. And as we've learned more about domestic violence, drug abuse, and other areas that have an intersection with brain injury, we've understood that there are so many more injuries than are identified. Even though someone might have a concussion, go to the doctor, have a list of symptoms, and follow our protocol and go back later and get the exact help that they need for their specific symptoms, which may not always fix everything, but at least it's addressing the problem. Think of that as being the perfect ideal scenario. And while that happens, then there's also, think of 2 or 3 people who were injured, may not have ever gotten that first doctor appointment, and then go on to be more likely to be injured again. People with TBI will have a harder time using services and maintaining sobriety without accommodations. So when we think about someone who's had a TBI and is seeking help for substance use, it's going to be really important to remember that they may have challenges in some of those areas: cognition, memory, impulse control. They're going to need more than the basic package, the basic services to support them. So really important to be able to repeat things for them, give them something written or something visual that they can take home. Find ways to support them to keep the information organized, or to have a person check in with them, or have verbal check in where they tell you back what they understand that they need to do. Another complex relationship, like we were talking about brain injury and mental health, mental illness, TBI and substance abuse. It's hard to know which happened first, which caused the other. And it's not even necessary to really understand that, but just to take into consideration that someone may be treating symptoms for a TBI with substance abuse, and someone with substance abuse may be more likely to have or be in a situation to increase risk for TBI. Approximately half the people in substance abuse treatment have at least one brain injury. And one of the things that could help a lot is the screening process. We're going to talk just for a couple of minutes about screening for TBI. And I really learned a lot in this myself, although we have talked with other groups about their screening process and adding questions and how they can make changes in the way that they do intakes for people to kind of unlock information about previous TBIs or concussion. This next thing that we're going to look at was something that I really learned a lot more from. Substance use and misuse is a contributing factor to brain injury. So a history of substance use is more common among people with brain injury. Acute and chronic pain is more common. And then treating that pain as just one of the symptoms that someone might self-treat using substances for. And then 70 to 80% of hospitalized patients are discharged with an opioid prescription. The Alabama Department of Rehabilitation Services did a study on TBI screening in mental health and substance use disorder settings. The screenings for 186 people took place over about 6 months when they did this. And it was finished in March of 21, so it's very recent. They made this great infographic that really brings everything together from their study in a way that's quick and easy to follow in just a page front and back. So with this study of 186 people, they found that a history of TBI was associated with these diagnoses: childhood mental disorder, personality disorder, trauma and stress disorder. drug use, including tobacco and over-the-counter drugs, and these medications, antipsychotics and mood stabilizers. And important to note here that nearly 1 in 3 screened positive for TBI in this study. The training for the screeners included the Ohio State University online screener training, and there's also a what if there's a TBI online video training. Both of those are from Ohio State University. 83% of those trainers were aware that the facility treated individuals with head injuries. And I point that out because we all know people have brain injury. We all know someone in our life, in our home, if not ourselves, that have had a concussion. So even though it's called the silent epidemic, we do know lots of people who've had the injury. We've got the statistics. There's one happening every 9 seconds in Tennessee. We know that it's a common injury, but because you can't see it from the outside, it's often forgotten or overlooked. Or at the time of the injury, just for example, think about a sports-related injury, it might be downplayed and the person might not get the help that they need when they need it. Based on some of the co-occurring factors that we've been talking about so far today, think about someone in a domestic violence situation. They may not always be getting the medical attention that they need. With a concussion, they might be dealing with things on their own, not able to get to a doctor, or afraid to be treated for their injuries, or kept from being treated for their injuries. So we know that the injuries occur, but they reported that their facility intake does not currently include head injury questions. That was almost half. So the conclusion is that the screening for TBI and behavioral health settings should be routine. The screeners were aware that people were being treated at their facility who did have head injuries, the wording that they used in this study, but they simply didn't have the questions to ask to record that information and then to be able to use that information in treatment. If you look at this image and you think about all of these different groups and all of these different professionals who might be involved with someone in the treatment after a brain injury, and might be seeing them for all completely different reasons, not just the injury. We really focus on supporting the person with the injury by educating the professionals and the families and the individuals themselves about the possible downstream effects from the injury. We know that if all of these interconnected systems serving the person could identify the person's injury at the intake in that screening process, there could be less repeated injuries. There could be less symptoms. There could be less crossover and challenges within the services that they're offering to that person. Staff education, the individual understanding the injury better, and those around them, their family and friends, supporters of them, understanding the injury could make a huge difference. So being proactive and being educated about brain injury can lead to preventing the need for the long-term services and additional services like juvenile justice, homeless services, domestic violence. And maybe you can think of some other systems that might be involved over a person's lifetime that we didn't include on this list. If anybody wants to add anything in the chat, I can see our chat. So I'd be interested if anybody has a thought on some other groups that could be represented here at our table. I'll keep looking, but I'll go on to the next slide. So some downstream consequences of TBI. As we've been saying, there's crossover with these different areas that people might experience and have need for services, might have challenges in. 10 to 20% of patients with TBI develop a new substance use disorder after injury. All of these all of these issues, all of these possible consequences are connected and kind of tangled together. Even though everyone doesn't experience all of these problems, they're all precursors or results of brain injury. So the cycle can start with the injury. It can lead to disability. The disability can lead to pain, and not for everyone, but it can lead to physical pain, can lead to substance use disorder to treat the pain. There could be an interaction that causes a physical injury or violence that leads to incarceration. During incarceration, someone could be injured again. Then they could end up homeless, and the cycle can repeat and become more complicated. Just an example of one way that things can kind of turn into a much bigger situation, kind of snowball into bigger problems, and a person needing more services and more help that could have been prevented. Within 5 years post-injury, nearly 1/3 report some involvement with the criminal justice system. And of those, 41% have had a TBI, and in the adult justice system, 50 to 80% have had a TBI. Here's one example of why we need transitional services in medical care. Why something as simple as our protocol for concussion could help someone avoid a lifetime of supports needed, and a lifetime of being in a system of outside supports. Nathan was injured as a baby. Here he is at 10 months old. The injury was undiagnosed and he didn't get follow-up care. So here on the left, he fell down the flight of steps, no loss of consciousness. He's seen at the hospital. They said no concussion. There were no recommendations. He had bruising around his eye for weeks. So Nathan at 24 years, just a snapshot. Currently, he's in prison. He's an addict. His mom describes him as has tried everything. He won't hold down a job. He's unable to hold down a job. That kind of goes back to that ability to self-monitor, ability to express what's going on versus an intentional choice. It's unclear. He's very smart, but he really struggled in school, doesn't have very many friends, borderline personality disorder. So if he could have been identified early, when the injury occurred, he could have gotten help for the symptoms that he was experiencing then. He might not be down a path of using drugs and alcohol, having trouble with impulse control. Could have maybe been a completely different story. Adverse childhood experiences. So probably everyone who's on here has heard of and has learned something about adverse childhood experiences, ACEs. There was a huge study that took place. I think it was in the 90s. That I'm sorry, I didn't take a note on that. Over 17,000 people found, and they found through the CDC and Kaiser that the difficult things that you experience and how you experience those can make long-term changes in your life. So ACEs are linked to chronic health problems like mental illness, substance use problems in adolescence and adulthood. And they can also negatively impact education, job opportunities, and earning potential. ACEs are common. 61% of adults surveyed across 25 different states have reported at least one ACE, and 1 in 6 have reported at least 4. So we may have heard about ACEs. We may have done an ACEs test to see how many ACEs are in our own childhood. They include things like economic hardship, divorce or separation, abuse, growing up in a family with mental health or substance use problems, a family member who's incarcerated. There are things that we all can relate to and may have experienced in our own lives, but they are something that do affect a person when they've had a TBI. They do complicate the situation, and they do come into play. People deal with stress differently overall. And when we start thinking about ACEs and the changes that happen on a chemical level with the brain, with stress, heightened stress, like experience in an ACE, affect the way that the messages in your brain are sent. And I want you to think of like I'm sure we've all learned this back in high school or in a Psych 101 class, fight or flight. So when something stressful, something intense happens, you kind of have that moment, that millisecond, where you have this reaction to either react calmly or run and get away. If we can't quiet those messages that are happening at the time of the traumatic situation, that's happening in the frontal lobe and our prefrontal cortex, we might not be able to think of what to do. So that puts someone in a situation of being stressed, not knowing how to deal with this situation, and just being kind of frozen, if you want to think of it like that. Imagine somebody witnessing an accident or being in a crowd during a dangerous situation, or even just the feeling or the experience of that anxiety in a situation that might seem less stressful, less dangerous than it actually is, the feeling and experience of that. If the brain's able to quiet those messages quickly, they can react using their prefrontal cortex instead of getting that kind of frozen feeling where they don't know what to do. And then be able to deal with the situation. And it may be unpleasant, it may still be stressful, it may still be traumatic, but they're able to move through it. Resilience, greater resilience, greater connections between these parts of the brain's communicating when this happens, it can be supported and it can be learned, and can help people know what to do despite that stress. So the greater the prefrontal cortex activity, the greater recovery. The quieter the amygdala, the better that we can quieten those messages, and you can plan and act without the emotions getting in the way. Now think of the stresses that don't end quickly, like a child living with an ACE, like physical or emotional or sexual abuse, or maybe a person living in a war zone. That kind of chronic stress literally causes changes in the brain. And chronic stress causes the brain to produce neurochemicals that can lead to inflammation in the brain. And it can lead to negative behavioral and health outcomes. Some of those could be obesity, depression, alcoholism, smoking, heart problems. All of these are related to chronic stress and can really continue to get worse if someone isn't seeking treatment. And it helps to understand where it came from and what started everything in dealing with that chronic stress. This pyramid shows it in another way. ACEs experienced in early childhood can affect your brain development. So just like we were talking about that injury that happens during the brain's developmental years, 0 to 25, the younger you are, the greater the brain development's happening in the different parts of the brain. So you're having each lobe of your brain that's in charge of different abilities, having the most developmental change happening, the younger that you are. But imagine that happening as someone's experiencing an ACE. So it can lead to social, emotional, cognitive impairment as the child's getting older. Health risk factors like smoking, drinking, obesity, lead to health problems and eventually an early death. So if we look at the ACEs at the bottom, the changes in the neurodevelopment that can go on to cause emotional, cognitive, social impairment, and then health risk behaviors. And some of those might be coping mechanisms and self-treatment. And then that can eventually lead to further health problems and social problems that might lead to increased risk for an early death. Children with ACEs are much more likely to develop mood disorders, have poor decision-making skills, poor impulse control. Sounds a lot like brain injury, doesn't it? Children with ACEs are much more likely to have weaker connections between the prefrontal cortex, we were just looking at that a minute ago, frontal lobe, and the other key areas of the brain. And originally, ACEs were being looked at more for these things on the top. If you're looking at this tree and we look at above ground, originally they were looking at ACEs as more of an individual or maybe a household related experience, but they're also based in the child's community. There was a second set of ACEs, and this has been called the pair of ACEs, that also took into consideration changes in the person's, or not changes, but experiences in the person's environment. If the person regularly experienced violence, had a lack of opportunity, they experienced discrimination, poverty. So there is a list of ACEs that is used when you complete that that test to understand your number. But there is a bigger picture that was acknowledged with the community environments too. Another way to think about this is like an iceberg, with the top of it showing you what you think is already an obstacle that you can recognize and deal with. And then there's actually so much more that's under the water. And that's what these community environments are that also come into play and also are a whole second layer of ACEs. So some of those things sounded pretty dismal. And while people do have brain injury and experience other challenges and might need other types of supports, and it can be a little confusing and hard to figure out what all a person needs and how to best support them, there's hope and there's more that can be done. And we're going to show you some things that we think will be helpful to you in working with someone with a brain injury, whether it's concussion, whether it's recent, whether it's a more severe injury, something that may have happened in the past, or something that coincides with another challenge that you're dealing with. At the individual level, the person can do things and be supported to do things to take better care of themselves. We have a great training on brain health. It's on our website. We can also provide the trainings like we're doing today. We have a great handout I'll show you on our next slide in just a minute that'll go into more detail. But brain health isn't just something for people who've had a brain injury. It's not just a change that needs to be acknowledged after someone's had an injury to their brain. Making more of an effort to eat better, to get better rest, to stay away from alcohol and drugs, to do things to help their brain. It's also helpful for anyone. It's one of our most requested trainings, and it's something I've learned more about as we've learned about it as a program. Wendy, who's on here with us, is a certified brain health coach, and I may have said that wrong, certified brain health consultant. And she can help teach you more about it, but you can also go to our website and our YouTube training channel to learn more that you could apply to your own day. At the individual level, someone can get screening for brain injuries early on, and it can make a huge difference, as we've talked about, just adding those questions, understanding the injury, and keeping it in mind in treatment. continue to get that monitoring and checking in with their doctors and referring back to that injury that happened, and then re-engage in treatment as needed. So there are things that can be helpful and make a difference at any point in a person's life for treatment. This is the brain health handout that I was talking about. It provides evidence information. It goes into evidence-based information, and it goes into details about the ways that you can make simple changes in your life, eating better, avoiding toxicity, becoming more resilient, building that resilience that we were just talking about that can help you be more prepared for experiencing difficult things in life. And this is a free resource. It's actually 4 pages of information. When you go to look at it online, it's a PDF. Just a really helpful way to take a closer look at what you're doing and ways that you can apply this information to the people that you serve as well. So we're going to look at some specifics here on some tools and some ways to help when someone's had a brain injury. This is the HELPS screening tool. HELPS is the acronym that stands for head injury, emergency room, lose consciousness, problems in daily living, and sickness. It's a first step type of screening tool. Thank you for putting that in there, Paula, for our brain health. It's a first step screening tool to gather information. So it's not used to diagnose brain injury, but more just to screen for the possibility. It's very easy to follow. It's all on one page. So you're going to ask these types of questions. Have you ever hurt your head? Were you seen in the emergency room? Did you lose consciousness? And then that's, like we said before, it's going to be only 1 in 10 that's going to apply to. And did you have any of these daily problems since the injury and any significant sicknesses? These are some of the things to look for when someone's had a head injury, and it's included in our signs and symptoms handouts, and when concussion symptoms aren't going away. And we'll look at those complete handouts in just a minute. But we suggest looking for these symptoms and circling those that the person's experiencing and then sharing that with the doctor. So sometimes just having the handout and writing on it and being able to carry it in can help a person be more comfortable explaining what's going on, remembering what's going on exactly, and sharing those symptoms so that they can get some help. Especially for a child, you really don't want them to deal with symptoms like you might, in the same way that you might expect from an adult. You want to be patient. You want to use wording like what happened to you. We learned this through our friends with DCS. The difference in the wording is really important because coming at it from a concept of what's wrong with you is completely different and not okay compared to letting somebody know that you understand that what happened to them is the cause for what they're going through. Continue to watch them over time and get the right people to help stay involved for support. And then if you see any trouble that they're having, refer them back to the doctor. Give them tools like we have, including our symptom tracker. We'll look at that in just a minute. And don't hesitate to suggest referrals that you think that they might need. So maybe they need, maybe they could use help from a mental health counselor. That you might be the only person who's giving them that input, and they might not think that that's the right next step, but it can be helpful. At the community level, some changes that can be taken place, sort of a broader change, is educating everyone about concussion. And that can include healthcare providers, like with our protocol. Substance use programs need to have a better understanding of TBI. Police, correctional and probational officers. Some of this is to prevent and treat ACEs, and some of it's to prevent and treat traumatic brain injury. And it's all about educating people about the brain and about concussion and brain injury. These are some of the signs and symptoms tools that I mentioned. We have on the left, there are signs and symptoms tool for people who communicate without words. And in that, we're saying someone who might not be able to explain to you exactly what those symptoms are like. So that could be an adult who is just not able to verbally communicate those things, but you can look for changes like holding their hands over their ears with a loud or overstimulating sound, forgetting routines, changes in skills that they may have already had. That's just a close-up glimpse there of some of those things that you might look for. On the right, we have our when your head has been hurt adult version, signs and symptoms. And then we're going to look at our young child and school age child one here. These are clearly for children. So we have 4 versions of our signs and symptoms right now. These you might share with the family and the school or preschool and help them to be able to better identify symptoms. It's also perfect to keep it at home. We always would suggest with our child signs and symptoms tools to put them up on the refrigerator, put them up somewhere we're going to see them every day, especially shortly after a concussion takes place. And just knowing that if you see these changes, there's reason for concern, and it is important that you get that information back to the doctor. And those are available in Spanish as well. This is the symptom tracker that I was talking about a minute ago. It's so straightforward. It's just this one page that you're looking at. It's a quick way, and this can be used for lots of things, but ours is specifically, we're thinking of concussion and brain injury symptoms. But you can list the symptoms, under what conditions it occurred, what was done, and what was the outcome. Did it work? Did it make things better? Having something like this in just a quick way that you can only write 2 or 3 words is a great way to communicate with the doctor. It's a great way to communicate with other staff of things that you use and things that work and don't work. So it's just a really nice way to quickly keep up with information and to be able to share it in a very easy way. For people who return into a program after a concussion, we have permission from the CDC to have modified the return to school letter into a returning to program after concussion letter. And this is a very simple page front and back letter from the CDC. It's a modified from the CDC. It's on our BrainLinks website. And it has a place for the doctor to put their date, their name, the reported symptoms, really simple check boxes if you see that section in the middle. So they're not writing everything out. It really is maybe a 1 to 2 minute paper to complete. And on the back, it has danger signs and recommended short-term changes. We do a deeper dive on this on our YouTube channel, but it's just really nice way to be able to get the information in someone's hands that never got to see the doctor, or share the information even though your person that you're serving may not be able to relay that information that they got at their doctor appointment. When concussion symptoms aren't going away is a kind of a next step to our signs and symptoms tools. We are looking at the 3 that we offer now. We do have one for adults, and I kind of want to talk more about the 5 and under in school age just for a minute, because the 5 and under one will refer you to programs like Tennessee Early Intervention Services. And then the one for school aged children is going to help families who might not realize that there are programs out there that can be helpful, and that there's special ed services, including things like a 504 plan or an IEP. They may not have ever talked about those options in school until this injury occurred, and it walks them down the path of information that they might need. So all of our handouts here include what to look for immediately following the concussion, weeks or months later, and they're laid out in a way that you can look for possible changes down the road and supports even years and months and years after the injury. And then they do include free resources and information about Tennessee and national services. Even after someone has had brain injury treatment, brain injury rehabilitation, they still could go on to continue having problems and seeing changes. This handout's one of our newest ones, and it was designed to be a guide for the one on the left is children 7 and under, and the one on the right is for school-age children and adults. Kind of like when concussion symptoms persist that we were looking at just a moment ago. But this one goes into things that may happen following a brain injury, specifically for someone who's been treated for TBI. So it's especially geared towards rehab personnel and inpatient and outpatient therapy programs by medical personnel and trauma units, pediatrician offices, family practices, neurology, surgical offices, and other specialty offices. So it's much more specialized, but going to help people who really need this information have everything in one place. And this is our brainstorming solutions tool. I'm just going to talk about it for a tiny moment here, because we can go into this further in other sessions that we do. But this tool is really great because it helps to focus on a specific challenge. You don't have to fill out the entire thing. You can go to the section that you need and come up with a plan. So in determining somebody's strengths and challenges, you can use these other evaluations, but we really recommend when there's a brain injury. It can also be used for other people as well. It's not just for people with brain injury, but we recommend going in and going to the section based on abilities that you need and getting the information together to start brainstorming some ideas for strategies to help them. And then it really goes hand in hand with our strategies and accommodations tool. It matches the exact same information that you would fill out on brainstorming solutions to this one. There's a key on there that can help you determine which professional might be most helpful with that area. Things like initiation, attention, awareness. It's really nice to be able to have several strategies to choose from and know exactly what professional can be most helpful. This is also one that we have a deeper dive on our YouTube channel, if it's one that interests you. Our toolkits I mentioned briefly, we have free toolkits available on our website, one for healthcare providers and one for school nurses. And they have everything in them as a printable PDF. So the whole thing is free and a free download. We've been providing those since 2019. And coming very soon, we're going to have 2 new toolkits, one for survivors and caretakers and another for service professionals. So those will be coming up on our website very soon. And just a quick glimpse of our YouTube playlist. We have a YouTube channel that we have full-length training on. We have tiny little clips about specific handouts or specific topics. And you might notice that most of them, when you get on there, are 10 minutes and less. So if you have a specific topic that you wanted to know a little bit more about, or you liked one of our handouts that I just talked about for 30 seconds or less, you can get much more of a walkthrough on our YouTube channel. And we have a lot of great new website updates. I just wanted to give you a tiny glimpse of what that might look like when you get on there. If you look at this, have an injury, the little heart hands, that's the section to go to for families and survivors. And the second set here below on this image shows you, if you go to for professionals, what you're going to see when you get on there. We've made it much nicer to go through and see images and click on what you want in a quick and easy way. And I do want to not leave without everyone hearing about the service coordination program in Tennessee. It is free. It provides a local person for you who understands brain injury to help you access services. There's a weekly virtual support group going on now that's made it so much easier for people across the state to attend. You might not know, but there's also funding for people through the Tennessee Family Support Program to help people in Tennessee with disabilities to receive funding for different things. There is a limited amount, but it is definitely something that people can apply for and get help that they need. The service coordinators can help people apply for that. So I'm gonna give you just a moment to, I think let's get back on that for just a second. I'm gonna give you just a moment in case people have any questions and would like to type those into the chat. I haven't noticed any as we've been going. No. If anybody has any questions here at the end, I welcome those, and I'll take just a second to remind you that we have a survey that we'll show here in just 1 second. And if you take out your phone, you can do the QR code to go straight to our survey. It'll take you less than 1 minute to complete. It's very important for us to get that information for our grant records. We really appreciate your feedback too on our training. And I did want you all to get to see that we do have a social media presence. We're on YouTube, we're on Twitter, Facebook, and LinkedIn. So we'd love for you to follow us on Facebook and connect with us on LinkedIn. And hopefully we intrigued you about our YouTube training channel, and you might find some things on there that you'd like to use and bookmark our page for that. But thank you so much, everybody, for joining today. Thank you, Paula, for sharing those resources in the chat. Everybody, please do take a minute and do our survey, and you'll get a certificate of attendance after you complete it. And we'll stay on here. I know that we haven't had a lot of questions. That's okay. Sometimes it feels like you get a lot of information in a webinar and you might not have questions till later. But we would love to hear from you. And if we have any questions or people that want to stay on longer and talk, we'll hang out here for a little bit for you. Thank you very much. Thank you guys. I appreciate it.